Depression creeps up on you quietly. At the very beginning, you struggle with the little things, but you usually choose to ignore them. It's like a headache. You'll tell yourself it's temporary and it'll pass. It's just another bad day. But it's not. You're stuck in this state of mind. You get used to putting on a social mask and you continue to live among other people because that's what you have to do. That's what others do. However, the problem does not go away. You struggle to put on a play every day and it starts to cost you more and more. That is why you fall even deeper, and that's when you slowly start to back away from friends and family, sometimes completely shutting them out.
Get out of my room!
All satisfaction is gone. The little things that used to bring you joy are now worthless. Even the simplest tasks become painful, and that is why you lack motivation now. Why would you keep on trying if nothing makes you happy anyway? All of this makes you feel even worse and you get caught up in a vicious circle. Suddenly you find yourself living in slow motion. Days become indistinguishable, just white noise, just heaviness filling your mind and spilling over your body. You feel as though you will never be happy again. You continue to back away and destroy relationships. You're ashamed for everything you've done and everything you haven't. There is a part of you that wants to make things right. A sudden positive upsurge makes you want to go out and meet people, but it's all very short-lived because you know it won't work anyway. And so in the end you choose to be alone in your comfort zone where no one asks any questions. The low self-esteem and the lack of purpose become unbearable. You finally realize you can't go on that way, and two things can happen. You either decide to get some help or you might attempt a suicide.
All right, so we're going to learn about depression today, and with me is a special panel. First up on my immediate left is Dr. Sibulelo Seape. Dr. Seape is a is a specialist psychiatrist, and I might as well just add that she's also chairperson of Psychiatry Management Group and also part of the South African Society of Psychiatrists. Welcome to Health Talk,
Thank you.
Dr. Sibulelo.
Dr. Mda.
All right, and of course next to Dr. Seape is Prof. Melvin Freeman. Prof. Freeman is the Chief Director, Non-Communicable Diseases within the Department of Health. Welcome to Health Talk, Prof.
Thank you very much.
Correct. And last but not least is Nkini Phasha. Nkini is a board member of the South African Anxiety Group. Welcome to Health Talk once again.
Thank you. Good to be here.
So all of you obviously are no strangers to this show, and I'm honored to have you back again. Perhaps let's start with you, Dr. Seape. What are we talking about? What is depression?
Depression is one of the big psychiatric illnesses that affects most people in the world. It is an illness that not only affects the person who suffers it, but affects the people around them, almost like their whole ecosystem. And that is why it makes it so aggressive and so serious. But it involves having, the symptoms are around sadness.
Right.
And the sadness is all-encompassing.
Okay.
And it is literally from your head throughout your body in terms of your thoughts.
You mentioned sadness. I mean, more often than not people will say, but you know, there's a difference between suffering from depression and just feeling blue or feeling down or feeling sad. Yeah?
Yeah, you know, we all feel sad when something has happened. Yeah. But when people are depressed, the sadness is the greatest it will ever be. It does not necessarily have to match what has happened. Sometimes there's nothing that has happened, and it doesn't get shaken off. We all get sad because we are in an accident, we have a bumper bashing, and we get over it within the next hour. you know, but depression doesn't just get away. You have to treat it to get away. And the sadness that we always all experience doesn't debilitate us. We are still able to carry on our jobs. We are able to love the people we love. We are able to engage in things we are, you know, interested in. Whereas when you're depressed, you can't do that. It takes everything away from you. So you can't do your job because your head doesn't work. You can't think. You can't. Your memory is poor. Your focus is poor. Your body's tired. You're sore. You've got pains that are not otherwise accounted for. You are not happy and you don't have good relationships with your family, with your colleagues. Your job, you can't do it. You're too slow. Everything seems impossible and difficult, which is quite different from sadness.
All right. Nkini, how much of a problem is this? I mean, from a SADC perspective, I'm sure you know, this is what you deal with almost all the time. How much of a problem is it in South Africa?
Look, I may just add before I actually answer that. I think what is also critical to mention is that it's a medical condition.
Right.
You know, I think, you know, very often you hear people saying, well, you know, it's something that you can snap out of, you know, come on, just, you know, what is depression? It definitely is a medical condition, just like you would have diabetes, you'd have, you know, hypertension and so forth. But certainly when we're talking about prevalence, I mean, we know that really this is a significant, you know, problem, particularly in the landscape of, you know, our society. You know, the statistics show us that, you know, just over 15%. But what we are saying as a South African Depression and Anxiety Group, we believe that that figure is in fact quite conservative. There's still a lot of people, and due to lack of awareness and lack of knowledge, that are not presenting themselves. And of course, if you're then not presenting yourself to seek help, professional help, you are therefore not included in the statistics. So we believe that we really could be sitting with a much of a, you know, more bigger, you know, problem than what the statistics are telling us.
Okay. Prof, how much of a problem is it in the public sector, if I could call, or perhaps looking at it, you know, the countrywide and globally perhaps? We hear the WHO says, let's talk depression. Clearly this is a problem. Your comment?
Yeah, indeed it is a big problem, and it's a growing problem. And it's something that certainly we in the Department of Health realize that we need to do more, partly because there is a large what we call treatment gap, as my colleague was talking about. And so it's true that many people who do suffer from depression don't go and seek help for it, partly because of the stigma attached to it, partly because they don't know where to go, partly sometimes because there is no service available, and that is a reality that we have to face. Yeah. But
we're going to come back to you know, access to treatment and all of that. But let's just stay for a moment on the stigma. I mean, oftentimes people talk about stigma when it comes to conditions like HIV and AIDS and so on. How much of a problem is stigma with mental illnesses in general?
It's
anyone.
Look, it's massive, and I think, you know, again, you know, just looking at the dynamics of our society, you know, there are myths, you know, that fuel the stigma. So what tends to happen is when people don't know something, when they don't understand, and now we're talking this, you know, medical condition, this mental disorder being depression, people then tend to actually, you know, stigmatize or discriminate or come up with myths to try and explain, and I put it in inverted commas. So that fuels the stigma. A lot of people that suffers from depression, you know, they feel that, you know, they are afraid to actually come out and seek help. And particularly if you look at men, I mean, you know, we are raised in a society as a man that, you know, you are told tigers don't cry. So that also, you know, fuels, you know, the stigma, because then if you are then, you know, feeling that the society is not welcoming of you to express, you know, this disorder that you are experiencing, you know, then obviously then you feel discriminated, and therefore you don't talk about it. But also there's another dimension when we talk about stigma, and that is self-stigmatization. Right. You know, so when you feel that the environment in which you exist in will discriminate against you, then you tend to then self-project that as well, and then also, you know, stigmatize yourself, you know, in living with a mental disorder such as depression.
Okay. Dr. Sabi, I'm sure you want to add to that, but you know, you're welcome to do that. But what I need to ask you is, we heard that it's a medical condition. Who's at risk of developing depression? What causes depression?
Everybody's at risk. You and I and the two gentlemen sitting here and all of you sitting in the studio are at risk. It is a psychiatric disease, okay? Everybody's at risk because there could be genetic loading, for starters, because people are living in difficult times. I think all of us can attest to the fact that the country is a difficult place right now, okay? And children are difficult, jobs are difficult, employers are difficult, life is quite difficult. So already we almost predisposed to be in depression, to be depressed, excuse me.
Well, maybe someone could say, but that's stress. How do you differentiate between stress and depression?
Okay, you know, what I find a lot is that people are more comfortable to be called stressed as opposed to being depressed,
Right.
which is fine for them, I think. But when the stress is such that you cannot cope with it, when it's such that it is causing physical changes in your body, especially in your brain, when it's such that it is debilitating you, when it is such that you're unable to function, your normal functions as a doctor, as a man, as a daddy, as a talk show host, then that is when it is depression and it needs definitive treatment.
We were talking earlier about myths and attitudes, community attitudes and stigma and so on.
Yeah, stigma is a big problem. It's
Yeah.
a big problem. Generally, psychiatrists are regarded as doctors for mad people. And as soon as you're interacting with a psychiatrist, that means you're mad, which is unfortunate, really, because then it keeps people away from coming to present. And once they're referred to us, they come dragging their feet and they're not impressed.
Okay.
It is serious because, first of all, people don't know.
Yeah.
As we are well aware, people don't know that this is a serious illness. They are not aware that there is treatment. And what encourages stigma are from families. You start to be stigmatized by your family because you mostly are mad. Then you have employers who then are going to treat you differently. They put you in a different office. They're afraid of you. They don't give you the responsibilities you should have.
Yeah.
And you're demoted, you know. And society in general stigmatizes. And
this is
please
clearly
allow me to say,
Yeah.
and I'm sure, Melvin, with great respect, government is also stigmatizing patients because we do not have access to healthcare facilities
I think that's an
where we
opportune
are.
point to break it at this point because we have to go for a quick commercial break. When we come back, yes, we're going to hear more about the role of government in this and perhaps learn more about the stigma or at least the impact that depression has on society and everywhere else. Please stay with us.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
It's so good.